How to recognize the symptoms of appendicitis. Appendicitis occurs when your appendix, a worm-shaped pouch attached to the large intestine, becomes inflamed. It can be life-threatening if the appendix bursts, but doctors usually remove it surgically before this happens. Belly button pain. Appendicitis pain often occurs in the lower right side of the abdomen. The first sign, however, is typically discomfort near the belly button, which then moves to the lower abdomen. Some people, including children and pregnant women, may experience pain in different areas of their abdomen or on their side. The pain also will get worse if you move your legs or abdomen, cough or sneeze, or are jarred during a bumpy car ride, for instance. Appendicitis is an inflammation of the appendix, a 3.5-inch long tube of tissue that extends from the large intestine. No one is absolutely certain what the function of the appendix is. Emergency symptoms: fever over 102 degrees Fahrenheit, 38 degrees Celsius. Back pain. Decreased appetite. Nausea and vomiting. Diarrhea or constipation. Painful urination. Pain in rectum, back, or abdomen. Be on the lookout for less common symptoms of appendicitis. In addition to the symptoms above, you may also experience symptoms that are less commonly associated with appendicitis. Here are some less common symptoms you can look out for. Painful urination. Vomiting before abdominal pain begins. Sharp or dull pain in the rectum, back, or upper or lower abdomen. Pay attention to abdominal pain. In most adults, your appendix can be located on the lower right side of your abdomen, usually 1/3 of the way between your belly button and hip bone. Note that this location may be different for pregnant women. Watch for a path of pain. The sharp pain might move from your navel, belly button, to the area directly over your appendix 12 to 24 hours after you start experiencing symptoms. If you've noticed a distinct progression like this, go straight to the emergency room. In adults, symptoms of appendicitis may get worse within 48 hours. If you're diagnosed with appendicitis, it is considered a medical emergency. Press on your abdomen. If it's too painful for you to even touch, especially in the lower right portion, consider going to the emergency room. You may also feel a tenderness in your lower abdomen when you press on it. Look for rebound tenderness. If you press on your lower right abdomen and feel a sharp pain when you quickly release it, then you may have appendicitis and need medical attention. Rapidly worsening pain. Low-grade fever and chills. Appendicitis symptoms may mimic those of a stomach bug, including a low-grade fever, chills, and shaking. One thing we do know: we can live without it, without apparent consequences. Vomiting, nausea, or loss of appetite. You may, however, have a couple days where your appetite is low with some mild nausea and vomiting, similar to what you might have with a stomach bug. If it improves after a day or so, you're probably fine. Constipation or diarrhea. Like many of the other symptoms, these may not be severe and probably will come on after you've already experienced abdominal pain. Gas and bloating. These are general symptoms that may indicate appendicitis if they occur in conjunction with other telltale signs, such as fever and pain in the lower right abdomen. Appendicitis is a medical emergency that requires prompt surgery to remove the appendix. Left untreated, an inflamed appendix will eventually burst, or perforate, spilling infectious materials into the abdominal cavity. This can lead to peritonitis, a serious inflammation of the abdominal cavity's lining, the peritoneum, that can be fatal unless it is treated quickly with strong antibiotics. Sometimes a pus-filled abscess, infection that is walled off from the rest of the body, forms outside the inflamed appendix. Scar tissue then walls off the appendix from the rest of the abdomen, preventing infection from spreading. An abscessed appendix is a less urgent situation, but unfortunately, it can't be identified without surgery. For this reason, all cases of appendicitis are treated as emergencies, requiring surgery. What causes appendicitis? Appendicitis occurs when the appendix becomes blocked, often by stool, a foreign body, or cancer. Blockage may also occur from infection, since the appendix swells in response to any infection in the body. What are the symptoms of appendicitis? The classic symptoms of appendicitis include dull pain near the navel or the upper abdomen that becomes sharp as it moves to the lower right abdomen. This is usually the first sign. Loss of appetite. Nausea and/or vomiting soon after abdominal pain begins. Abdominal swelling. Fever of 99–102 degrees Fahrenheit. Inability to pass gas. Almost half the time, other symptoms of appendicitis appear, including dull or sharp pain anywhere in the upper or lower abdomen, back, or rectum. Painful urination. Vomiting that precedes the abdominal pain. Severe cramps. Constipation or diarrhea with gas. If you have any of the mentioned symptoms, seek medical attention immediately, because timely diagnosis and treatment is very important. Do not eat, drink, or use any pain remedies, antacids, laxatives, or heating pads, which can cause an inflamed appendix to rupture. How is appendicitis diagnosed? Diagnosing appendicitis can be tricky. Symptoms of appendicitis are frequently vague or extremely similar to other ailments, including gallbladder problems, bladder or urinary tract infection, Crohn's disease, gastritis, intestinal infection, and ovary problems. The following tests are usually used to make the diagnosis. Abdominal exam to detect inflammation. Urine test to rule out a urinary tract infection. Rectal exam. Blood test to see if your body is fighting infection. CT scans and/or ultrasound. How is appendicitis treated? Surgery to remove the appendix, which is called an appendectomy, is the standard treatment for appendicitis. Generally, if appendicitis is suspected, doctors tend to err on the side of safety and quickly remove the appendix to avoid its rupture. If the appendix has formed an abscess, you may have two procedures, one to drain the abscess of pus and fluid, and a later one to remove the appendix. However, there is some research showing that treatment of acute appendicitis with antibiotics may eliminate the need for surgery. Antibiotics are given before an appendectomy to fight possible peritonitis. General anesthesia is usually given, and the appendix is removed through a 4-inch incision or by laparoscopy. If you have peritonitis, the abdomen is also irrigated and drained of pus. Within 12 hours of surgery you may get up and move around. You can usually return to normal activities in 2 to 3 weeks. If surgery is done with a laparoscope, a thin telescope-like instrument for viewing inside the abdomen, the incision is smaller and recovery is faster. After an appendectomy, call your doctor if you have uncontrolled vomiting, increased pain in your abdomen, dizziness, feelings of faintness, blood in your vomit or urine, increased pain and redness in your incision, fever, pus in the wound. Can appendicitis be prevented? There is no way to prevent appendicitis. However, appendicitis is less common in people who eat foods high in fiber, such as fresh fruits and vegetables. Rebound tenderness. Rebound tenderness occurs when you push on the lower right part of your abdomen and then experience pain when releasing the pressure.